Welcome to Yin Yoga Lifestyle. I am your host, Colette Darville. Cultivating our body's resilience and inner silence and its application to all aspects of your life. Let's become enlightened and enjoy the power of intuitiveness and creativity. You are listening to Society Bites Radio, social interaction for the mind and soul. Hello, and thank you for joining us today. I am your host, Colette Darville, and this is Yin Yoga Lifestyle. So now let us take a deep meditative breath. Inhale, so. Exhale, hum. Dr. Charles BENS, PhD, is a cellular science medical nutritionist, author, speaker, and wellness consultant, specializing in the prevention and reversal of chronic disease. He is the founder and president of Healthy at Work, Inc., a wellness education and consulting company focused on improving the health of employees. The company provides workshops on a wide range of health topics. Dr. BENS has written 9 books and over 300 articles, including Healthy at Work, Your Pocket Guide to Good Health. He has received numerous awards and recognition for his work to improve communities, organizations, and the health of employees, including a letter of commendation from the President of the United States and speaking at the United Nations Habitat for Humanity Conference in Istanbul, Turkey. Dr. BENS uses solid research and creative delivery techniques to challenge and inform his audiences. When asked where he got his education, Dr. BENS replies 99% from the 1,000 clinical trials he has researched. And thanks again for being on Yin Yoga Lifestyle, Dr. BENS.
Thank you, Colette. It's my pleasure to be here again.
Now, you've been doing some really interesting research and coming up with some really interesting things for us today, and it is related to the COVID. So we are going to get right into this because it's very important. And so I'm going to go back to something related to what I watched. And I watched the program 60 Minutes and the long hauler story in which the Mount Sinai Hospital in New York had set up a department to help patients who were recovering, who had recovered from COVID, but were suffering now from the after effects of the disease. And this is many months later. But for many doctors, this is a new, unexpected area of treatment that they don't understand, which has many of them baffled. Why is this now? It's another stage. Why is it so complicated?
Well, I think the main problem is most of the conventional doctors don't get very much education about nutrition and how it can impact your health. And so when you look at all the damage being done in the brain and the heart and the lungs and the liver and the kidneys and the intestines and the blood vessels, they just don't know what to do with it because they don't have a prescription medication to deal with it. Mm-hmm. And so they're in the area of the unknown. They don't exactly know how the damage is being done. They don't know how long it will last, and they don't have any protocols to fix it.
So most people would say, there's always going to be something that you're going to be dealing with after you've had a serious issue. But some of these issues aren't normal, are they? I mean, some of the COVID after effects, what are they that people are dealing with?
Well, they get brain fog. They can't think straight. Their kidneys start to dysfunction. Their lungs aren't working the way they could. They can't get a deep breath. They can't exercise anymore. The heart has arrhythmia, or we've even had people had strokes, or have a 23-year-old had to have a heart replacement. And so there's things that are happening, and they're going, this is not supposed to happen this quickly. In other words, these diseases are supposed to progress over a certain period of time, like months and years, not over weeks. So this particular damage that's being done is unique in how quick it comes on you, how many places it hits you, and how much there's a lack of evidence about what to do with it.
So this is another question that's interesting because, when you're talking about all these things, we have our body's amazing, and we have so many things that our body does to help repair and fight against disease. So, with that in mind, our body has its own repair process when disease invades our body, right? So, why doesn't that happen for us?
Well, in this particular case, it has to do with several things. Like it depends on what the viral load was that you became infected with. And so you can have a very light viral load, a couple of particles, or you can have a very heavy viral load because you're in a hospital or you're in a situation where you've inhaled a lot of the virus, and your body responds according to how much of the viral load is that's actually in your body when the immune system starts to react. So that's the first thing. The second thing is if your immune system is not working very well, then you're going to have problems and you won't be able to respond appropriately, and that ends up creating problems in your body. Like your lungs have a thing called the cytokine storm, and so they overreact. Your body's immune system overreacts, and then if you don't address those things very quickly, the amount of time it takes you to respond to the virus and get things under control in terms of inflammation, which is one of the main factors, then that spreads the damage. And so there's lots of things that kind of contribute. And we know now that 90% of people aren't metabolically healthy enough to respond to this illness because they just eat a very terrible diet without as many vegetables as they should, and too much junk food and too much food that doesn't have good nutrition in it. That's why 70% of the population has a chronic illness. If you have a chronic illness, your body's already trying to repair something, and now you put something else on top of it. So those are the things that contribute to this big problem.
Now you mentioned, you talked about that people have a really imperfect diet. So can you explain to us the perfect diet, what we should be taking a notice of?
Well, there was a new study out last week, and we've known for 30 years that the Mediterranean diet was the best diet. This is based on 125,000 nurses being monitored over a 30-year period. And so we know that chronic illness impacts those people less that eat this diet, which is basically fish and poultry and vegetables and fruits and nuts and seeds and healthy oils, and avoids all the junk food without the good things in it. But the new study that came out last week said, yeah, that's good, but you're still eating too much meat. And you need to stop the red meat, and you need to take more vegetables in. So it's now called the green Mediterranean diet because it has more vegetables in it. So people are eating like 1 or 2 vegetables a day, and they should be eating 7 or 8 or 9 vegetables a day. And that's just almost impossible for the average person to even contemplate. That's why so many people are sick and getting sicker.
Yeah, and I know in a previous podcast you did say that you should supplement. There are green powder drinks that you can supplement with, right?
Yes, there's a couple out there. Greens First is a good one, and I like that one. And 1 scoop of this green powder gives you the equivalent of 7 or 8 helpings of vegetables. And so to a lot of people that don't want to eat all those vegetables with every meal, because I eat 2 or 3 vegetables in the morning and 2 or 3 at lunchtime and 2 or 3 at dinner, but the average person's not willing to do that. So they take the green powder along with an excellent diet. You can't just take the green powder and still eat your lousy diet.
Right.
It's not going to work.
Right. You still have to do the work and clean it up, right?
Exactly. You have to eat the right things because every food that you put in your mouth either has high nutrient value or it has low or medium nutrient value. You should eat as many foods every day that have the highest nutritional value. And that, unfortunately, is vegetables is the number 1 on the list.
Yeah. Now, you have helped several people overcome COVID, 19. And this is your own protocol that you've created. Um, um, because and the after effects with a protocol you have developed for many months later. So, can you explain what that is?
Well, in the first instance, if you get things into your body very quickly to put that virus on a notice that something is happening and they need to pay attention, like
Mm,
vitamin C, vitamin D, and zinc, and we like olive leaf extract. If you take those things immediately, and I'm talking every hour. You take C 1 hour, then you take D the next hour, you take zinc the next hour, you take the olive leaf extract the next hour, and then you keep rotating that until the
right.
symptoms go away. That's the arresting. That's the part that will get you off of it. But if you don't continue that, at least for 2 or 3 more days afterwards, at lesser amounts, in other words, every 2 hours, and then a couple of days later, every 3 hours.
Hmm.
If you don't do that, then this virus has a way of suppressing the symptoms, but allowing the damage in your cells to continue. And that's what's been happening. 2 or 3 or 4 weeks later, all of a sudden the person gets these renewal of the symptoms and difficulties with these problems in the brain and the heart and the lung and the kidneys, and they go, "What the hell just happened?" Well, you didn't continue your protocol long enough to make sure that the virus was really dead and not going to damage you anymore. And that's why they're getting this thing called the long hauler. And now it lasts for months and months. They don't know how long some of them have lasted.
Yeah, and it's quite horrifying actually to think about that. You actually are going to have um, symptoms for a long, long time after you've been cleared of it. Um, it comes back to, again, we have to do the work. I mean, we can't just rely on doctors and nurses to do the work for us. We actually have to take responsibility for our own health, don't we?
Well, yes. And now, instead of just taking 4 things in order to get rid of the virus, now you have to take like 15 things in order to
Right,
repair all this damage.
right,
Because if you've
right.
got this damage all over, now you really need to concentrate on tackling this virus again with C and D and olive leaf and zinc and something called molecular hydrogen. You've got to really suppress the virus. Then you've got to get after the inflammation. So now we ask you take fish oil, take curcumin, take a thing called specialized pro-resolving mediators, they're known as SPM. This will push the inflammation down. Then you have to make sure you have enough energy in your cells. That means you need magnesium, which actually carries glucose into the cell so that you can actually make energy, and berberine, and then something called coenzyme Q10. That ramps up your energy levels. Now your body is actually ready to heal. Now you're going to say, okay, we're going to do this green Mediterranean diet, and we're going to put an enzyme in front of each meal so that we make sure we have enough enzymes to actually process the nutrients. Now we're ready to do the repair of this damage. So that's where vitamin E and vitamin B and a thing called NAD comes in, and pycnogenol and modified citrus pectin. So all these things repair damage to cells in the body. So now you've got a protocol that can actually work. And if you do that protocol for 3 to 6 months, then all the damage is repaired. Your body goes back to normal, and you can function exactly the way you did before, and even better. And I've had Olympic athletes go through this protocol, and their times for performance and stuff were better at the end of this protocol because a lot of damage that they had done before was now repaired. So this
Wow.
protocol really, and that's why it's been peer reviewed by 2 other doctors, and there's it's going into probably 3 medical journals in the next couple of weeks because the evidence is here. Everything works. I've got 25 references for all of these things doing exactly the things that I said they do. And so now we know that it works. It's been proven in people that I've dealt with. And now they're saying, yes, other doctors are saying, this can work. This is something we should all do.
You know, and talking about the protocols, hospitals such as St. Luke's and the Cleveland Clinic, they have had, and they still do have, nutritional protocols for specific organs of the body. Is this how we should be